Hello everyone, how you doing today? My name is Allison and thank you so much for joining us for this month's Medicare Minute. Today we are going to be discussing open enrollment, and as you know, October starts that fun season, so it's just in time for you to gain knowledge about open enrollment and how to do all the things. So let's dive in, shall we? All right, just some introductions. My name is Allison McMichael-Dahl, and I am the Baltimore County Department of Aging SHIP Manager. We are located here at the Bicota Senior Center on the 3rd floor, room 321, and we are here to support you with any of your Medicare questions. Our mission is to provide one-on-one assistance, counseling and educating anyone, beneficiaries, family members, caregivers, and help them to understand Medicare so they can make the best decisions for them. I want to also encourage you to subscribe to the Baltimore County Department of Aging YouTube page so you never miss one of our Medicare Minutes. Today, we will be discussing 4 big topics. The first one is know the changes you can make during open enrollment. The second one is review your current Medicare health and drug coverage. The third one is know how to change your Medicare coverage. And the fourth one is how to protect yourself from Medicare marketing violations. And they are going to be coming out like crazy, especially now that open enrollment is taking place. So it's important to know what changes you can make during open enrollment. The first thing I want to let you know is that Medicare open enrollment is when you have the chance to go in and make changes to your Medicare coverage. This time period opens at starting October 15th and runs through December 7th. However, whatever program or plan you've chosen to go with at the end of that period will begin and start and take effect on January 1st. During open enrollment, you can make certain changes to your health coverage. This includes adding, dropping, or changing your Medicare Advantage and your Part D coverage. You can make as many changes as you like during this time. But like I said, at the end of the period, by December 7th, whatever plan you have selected is what's going to be going into effect starting January 1st. During this time period of open enrollment, you can switch from Medicare Advantage plans to the original Medicare plan, or you can do the reverse and go from original Medicare plan back to a Medicare Advantage plan. However, it is important to note that if you do switch from a Medicare Advantage plan to an original Medicare plan, you have a short time period of picking up a Medigap without medical underwriting. And that time period is 60 days before your Medicare Advantage coverage ends and 63 days after your Medicare Advantage coverage ends. If you forget or don't pick up a Medigap during this time period, you're going to be stuck with that 20% coinsurance, and you might find it difficult to pick up a Medigap in the future. So make sure you take a look at that. I'm also going to link down below our descriptions between the original Medicare and Medicare Advantages that we did a Medicare Minute of in September. So that way you can go through and maybe get some more knowledge and understand what you want more if you would like original Medicare or a Medicare Advantage plan. You can also shop for a Part D plan during this time period of open enrollment. What you want to do is make sure that the plan is best for you based on your current prescriptions. Insurance companies have the right to drop medications from a formulary, so a prescription that is covered today may not be covered tomorrow, and you will be held responsible for 100% of the cost of any medications that are not on your drug formulary. You are probably going to receive a lot of mail during open enrollment season. It is important to know which mailings include information about your current coverage. No matter how you get your Medicare, if it's a Medicare Advantage or an original Medicare plan, you should consider the following things. 1, your access to healthcare providers and pharmacies you want to use, your access to benefits and services you need, and 3, the total cost of premiums, deductibles, and cost sharings amount, like the 20% that beneficiaries are responsible for if they have original Medicare. If you have original Medicare, visit Medicare.gov or ask for a 2026 Medicare and You handbook to learn about original Medicare benefits. If you have a Medicare Advantage plan or a standalone Part D plan, read your plan's annual notice of changes, or you can even check your Evidence of Coverage EOC. These notices list any changes your plan in 2026. Pay attention to any changes in the plan's cost, benefits, and coverage rules. And, of course, the drug formulary. The formulary is the list of drugs your plan covers. Make sure that your drugs will still be covered next year. Also, ensure that your providers and pharmacies are still in that plan's networks. If you're unhappy with any changes, you have the right to make a change to your plan. How to make changes to your Medicare coverage plan. First, you can call 1-800-MEDICARE to make changes by phone. You can visit Medicare.gov to compare options and enroll in plans online. You can contact the plans themselves and ask to enroll. But what I highly suggest, especially for those who are interested in Part D, is calling the SHIP office. We have some amazing counselors that are ready to help you. We can do in-person appointments, or we can do it over the phone. So call and let us know if you would like an appointment, and we can set you up with that. We can go through your drug plan, go through the prescriptions you have, and make sure you are using a plan that's right for you. Now, I want to talk about protecting yourself during this time, as marketing violations happen often. Medicare has rules about how Medicare Advantage and Part D plans can contact you and make their services. Knowing some of these rules can help you protect yourself and others from aggressive or misleading agents. Here are a few important rules to keep in mind during this open enrollment season. 1. Plans can send you postal mail. However, if you're not currently enrolled in their company's plan, they cannot call you, email, visit your home, or approach you in public to market their plans without your permission. 2. Plans are never allowed to suggest they represent or endorsed by Medicare or any other government agency. They also cannot use Medicare's name or logo in their marketing materials. If you're interested in enrolling in a plan, an agent must give you a scope of appointment, an SOA form. This is how you agree on what kind of products you'll be discussing during your appointment. So you're not sold things that you don't want. The appointment must be at least 48 hours after agreeing on an SOA. Before enrolling you in a plan, the representative must explain the plan's effect on your current coverage. They must also go through a checklist in which they make sure the plan is good and it fits your needs and your providers, your pharmacies, and the medications are covered and that they did not leave you stranded. So I encourage you to take action. Now is the time. You can call your state health insurance program, the SHIP office, to make your Part D appointment. We can also review your coverage options and make changes to your Medicare coverage. You can contact your senior Medicare patrol if you need to report some potential marketing violations. Your SMPS can help you prevent, detect, and report potential Medicare fraud, errors, and abuse. You are the first line of protection. And also, you can call 1-800-MEDICARE to make changes to your Medicare coverage or to request a new Medicare and You book. Thank you so much for joining me today for our Medicare Minute, and we will see you next month.